Good morning. This is Dr. Timothy Scott back here at LifePoint Medical. It is July the 10th of 2023. And first of all, I want to thank you so much for taking a minute to listen to me and hear what I got to say this morning. So I'll get right down to business. Okay. First of all, again, we are always around here striving to improve our communication with our patients. Okay, because we want to communicate with you. That's how we take care of your needs, and that's how we make a living, is by contacting you or communicating with you and getting things done and helping you. So I just want to remind everybody about our main number, 706-782-0016. Okay, and we have multiple voicemails on there. You can leave a message. It's working. We do have a little glitch with it, so don't get too upset, but we're trying to work with Windstream to figure that out. There's one little problem with it. But the other thing we got is we got a text line at 706-607-6685, and you can text us, and it shows up on the computer at the front desk, and they'll be able to take care of what you do. You can even text it, says, "Call me, please," and put the number in, and the tech will call you. The person answering the phone will get a hold of you. I have 5 full-time employees actually answering the phones, okay, and the phones ring a lot. Some people come in and say the phones are not working. I'm like, well, it's been burning up there. But I get all that. I understand the challenges related to communication. So I just want to do the text line. Plus, when you're on our website, drtsbeck.com, there's a place where you can do new patient appointment or request an appointment from an established patient. And then down at the bottom is a little thing, a text, where you can, again, chat with us right there in real time. So those are the things that we're trying to do to make it easier and to meet you at your communication, okay? Because we understand, anybody under 40 and you got to talk to them through text or email or something like that, and they're for 40 and older, we want to talk to you on the telephone. So I understand it's changing times, but I think we can accommodate everybody, and certainly if we're opening up more avenues for communication is always positive. Along those same lines, we're going to be offering a new service here in a few days actually. We've been working on this LifePoint Medical University, or LPM University, where we're going to be able to offer you a continuous educational upgrade all the time. It's going to be really neat. I've got my whole staff working on it, and it's got several of them who are very excited about it. So we'll be talking to you about that later this week, or we'll be working on it this week and maybe even launching it next week, I think. So RPM, if you're on the RPM program, make sure you're getting enough readings. We have to have a certain amount of readings every month for it to count. So the girls just wanted me to remind you guys that if you do have an RPM, I think you have to do 16 readings a month. So that's roughly one every other day or something like that. So just help us out there. We are getting good data from this, though, and it really is helping us. It's a little bit different than what I expected, okay, but we are getting good data from it, and I really appreciate you participating. And Medicare's really pushing these things because they know it makes a difference, and I'm all about it if it makes a difference. I mean, honestly, that's what we're trying to do. Again, I want to thank everybody. When I was on vacation, I just had a few patients give me some feedback, and they said they felt like when I was gone that the office was operating just like it was when I was here. Like they didn't know, they couldn't tell that I wasn't here. And that's extremely nice compliment to make. That's what we're trying to do here, is we're just trying to maximize your access to healthcare, your continuity with your healthcare, and your accessibility. In other words, we want to make it so that we're available to provide you with the healthcare you need, no matter what, not dependent on one person or one circumstance. Okay, so I really appreciate it. It's going good. It's challenging, okay, but I've been running this challenge now for 20 years, so I'm just going to keep trying, okay. As far as any kind of health tip, The only thing I'm going to say is it's summertime in Raven County and everybody's talking about the snakes. So I hate snakes. Sorry, I was born that way. But they're just everywhere, and I see way too many of them myself. Just be cautious and make sure that you've got small children, small dogs, or any dogs. Just make sure. That's what scares me more than anything. I got a puppy and a baby, so I'm worried about the snakes around the house. So you just want to be vigilant and certainly seek medical care if you do get bit. Okay, and the two main snakes that really are dangerous around here are the timber rattlers and the copperheads, and there seems to be plenty around. Alrighty, thank you so much for listening to me today. You have a great week. Give us a call if you need something, okay? Thank you.